Hello, merriment makers. Welcome back to another episode of the Merriment Making Podcast. I'm your host, Mary England, and today I am recording a video because I felt like it. So if you're listening on an audio-based podcasting platform, you're welcome to come over to my YouTube channel and watch me talk, listen to me talk while watching me, or you can just, I don't know, stay exactly where you are. Today, I am going to talk about the intricate details of my surgery hospital experience in hopes that it answers questions and is more of an FAQ kind of situation that allows us to talk about hospitals, anesthesia, endometriosis, appendectomies, and just the logistics of something that is not really that easy to wrap our heads around because it's something that's very scary. So I just wanted to pull the curtain back from everything that I experienced. I feel like it's part of my job in this world is to go through experiences and transmute them so that as you go through something even slightly similar, you have a little bit of a road mapped out in front of you so that you don't have to go through it blind. All right, so let's start out with some basics of an introduction to all of this. So, what is endometriosis? It is tissue that is resembling the lining of your uterus that's growing outside of your uterus. And it can grow anywhere. It can grow on your fallopian tubes. It can grow on your ovaries. It can grow on your appendix. It can grow on your vagina. It can grow in a lot of different places in your pelvic area. And basically, what's happening is you're menstruating outside of your womb. And it is the most common cause of extremely painful periods. It affects 10% of menstruating people worldwide. And if you want to know if you have it, like, or just, not getting intern syndrome here, but common symptoms of endometriosis, it's pain during menstruation, often on the left side. I actually learned that very specific part just while I was preparing for this episode. So that actually made me feel so much better because we never found something very specific for me about the left side of my body. And no doctor has explained to me that it's very common for the left side of you to just be much more in pain than any other part. So that made me feel so much better about why this was happening. So if you have like acute pain on the left side, where kind of like where your ovary is in that area, that is a sign. So what was happening with me, I've said it a couple of times now, but just to make this fully formed as one episode, I've had painful periods since I've had a period. I was a late, quote unquote, late bloomer with getting my period. I did not menstruate until I was 15 years old. And from the very first moment, it was awful. I was in such pain that I would vomit every single time, like just pure sickness the entirety of my period. And um it was never really something that was looked at as that being that weird. It was just like I couldn't handle it. And yeah, I mean, there was space created for me and like I was allowed to take off from work or school, but it wasn't like, oh, there's really something much wrong, much more wrong here. So your period should, it shouldn't feel great. You're supposed to get cramps, but it should not debilitate you in a way where you are so sick that you can't walk, you can't speak, you are vomiting and almost passing out due to the pain. And the reality is that when we're adolescents and we're getting our periods for the first time, that level of pain was so harsh to me at that moment that was a very normal reaction to that level of pain. And as I've gotten older and experienced this thing for 20 years, almost about every month, I have dulled out to the sense of pain, right? I've normalized it. There's a threshold, and my threshold for pain is extremely high now in a lot of things. And I would like to actually attribute endometriosis and these periods to a lot of that. And yeah, so um and because we don't really treat teenagers who are experiencing this for the first time with a lot of clout and dignity and respect, and ask them and treat them like, oh, this is not okay, most people are at least delayed about a decade before we assume like that something really is wrong in getting them treatment and getting them a diagnosis. For me, apparently it took 20 years, over 20 years. So what happened was I was starting to get very, I mean, again, it was always very painful, but in the past year, the level of pain was so much that I feel, I mean, I've never given birth, but I just can't, it felt like contractions, truly. I don't know how else to describe it when I was having my period. And at first it was only every other month because you ovulate from your ovaries alternate. And then it started to be every month. And then it started to be not just when I was menstruating, but also when I was ovulating. And then it increased to basically just being every single day. And it wasn't always every single day, but it was so frequent that I was freaked out. And I just decided that this was no longer okay. And I was really worried about what else was happening. So I started going to the doctor much more and trying to create some sort of plan of care. And what we ended up doing was we tried just doing birth control. We tried getting like, just doing other like more simple things, but it did not help. And if anything, I got worse. And yes. So we yes. So that is my kind of experience with this. And going back to symptoms of endometriosis. Okay, so painful feelings on the left side specifically, like more than it's like 65% of people have the acute pain on the left side. Pain during sexual activity, that didn't really start for me until maybe the past 6 months. But then when it started, it was very real. Chronic pelvic pain, that has happened for the past year. Heavy and or irregular menstruation, that's happened for me for 20 years. Pre or post menstruation spotting, and then off, definitely more post for me. Difficulties getting pregnant. I will just say that with the way that I have been with my sexual activity for 20 years, I am alarmed that I have not had a pregnancy scare. So, and so was my doctor, frankly. So, yes, I I am deeply infertile, is what I'm saying. Irritable bowel syndromes, not really for me. Fatigue, lethargy, and low moods, yes. And there are other symptoms, but these are examples of things that go along with endometriosis. Now, just having fatigue or a low mood does not mean that you have endometriosis. It goes all together. But okay, so it's like I said, 99% likely that I've had this since the beginning, 15 years old, so 20 years, and we got to start really listening to people when they are having issues immediately. So, question, what is the point of getting the surgery? Well, first of all, you can do things to manage symptoms, and for a lot of people it varies, right? Like how much pain you're in, how bad it is. Um and also something that's fascinating is that you can't see endometriosis from a scan. You can go to get like an ultrasound to see a cyst, but you cannot see the endo, like the little pieces of your uterine lining um growing outside of your uterus on an ultrasound, on any sort of scan that we have. The only technology that we have today to 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 actively diagnose someone with endometriosis is to cut them open. And I still have to say on record in this full-length episode about this that this is a female issue. If there was something like a little tumor in a penis and an ultrasound was not able to pick that up, and the only way for us to identify whether or not you had a tumor in your penis or your testicles was to open you up to get a diagnosis, to get treatment, we would be working on that technology very quickly to rectify that. I think that because this is a female issue, that there is no urgency here. I'm just saying. So I cannot get you cannot get treatment for endometriosis until you are diagnosed, and you cannot get diagnosed until it is seen, and you cannot get seen it cannot get seen until you are cut open. There's a big flaw in that plan. So not only are we getting delayed treatment an average of 10 years because we were assuming that people are just being a little whiny about our periods, but then once we finally get someone who not only believes us and is educated about endometriosis, which unfortunately a lot of OBGYNs are not, and it's diagnosed properly, or at least hypothesized properly, then you do need to go get a procedure done. And you need insurance. You need to be able to pay your deductible and your copay. And you need to be in a situation where it's healthy and available. Like, I am so deeply grateful that I live in America, and this was a couple $1,000s for me to pay for. It was not cheap, but it was not in a back alley. It was with a real doctor. I did not die, and I can pay for it over time. You know? Okay, so one of the points of getting the surgery is to get diagnosed so that I can get medication that will stop the endometriosis from growing further. The other part is while they're cutting me open, if there is endometriosis, because there's a potential that it could be wrong. I was terrified that that they were going to cut me open and then there was going to be like nothing, and I had just been like crying wolf this whole time, and I was like, am I just crazy? Like I was going nuts like a couple weeks before, thinking that I was just like making all this up. Truly, I was like, maybe I am just being like a little whiny girl and like none of this pain is real, and I'm just nuts. And they're not going to find anything, and they're going to be like, are you sure you're in pain? Like gaslighting myself. So, once they cut you open, if they see endometriosis while they're in there, they remove it. How they remove it is they burn it. They don't like scoop it out, they burn it. Now, endometriosis, what it looks like is it's kind of like black dots. If you want to look it up, you can. I'm very squeezy. I don't like looking at the innards of a human body. I think we're a little gross on the inside, but you're welcome to look it up. Just look up healthy uterus versus endometriosis or something like that. Or just look up endometriosis. You'll be able to see like pink flesh on the inside versus just, it's like little black dots. You can tell it looks kind of like just something toxic. Okay. So they're looking for that and they're burning it. And anything that's big enough, they will burn. And they're taking away. And then if you also have what I have, which is polycystic ovarian syndrome, PCOS, they also will take care of that as well. So I had cysts, and one of them was potentially about to bleed. So they took care of that and they removed that cyst as well. And Yeah, so they're going through, they're scanning around, they're looking at all of your areas, they're looking at your like everything in your pelvis, okay? And in my case, it also allowed me for my doctor to see something else that was wrong in my abdomen area, which was that my appendix had a tumor on it and that needed to come out. Okay, so we'll get to that in a minute. But before I go on, I want to talk about the difference between PCOS and endometriosis. So, PCOS stands for polycystic ovarian syndrome, and that is caused by a hormonal imbalance and higher androgens, which is AKA like a male hormone, like something that more like not testosterone necessarily, but it's a male hormone, okay? And endometriosis is caused by abnormal cell growth outside of the uterus and higher estrogen levels. Okay. So that means that if you have PCOS and endometriosis like me, I both have higher androgens and higher estrogen. I've just got both of both, always both, right? Endometriosis causes painful periods. PCOS causes infrequent and irregular periods. PCOS also has other symptoms like acne, excessive hair growth, thinning hair, weight gain, harder to lose weight. Okay. You can have both at the same time. One does not equal the other. They do not go hand in hand. However, having endometriosis does increase your likelihood to have PCOS. But remember that only 10% of menstruating people have endometriosis. Okay. Okay, so now let's get into my appendix because this was an add-on. I did not know that we were going to need to talk about this. So, an appendix is a small finger-shaped pouch that's attached to the larger intestine in the lower right abdomen, like down here. And its function is unknown. I love science. We're not really sure. We think it used to be something that helped us digest tough food back in the day when we were eating like rawhide or something. And now it's just kind of like taken a really long time evolution wise to just disappear. But yeah, it's located in the bottom right part of your belly. And an appendectomy is the name of the surgery to remove your appendix. What does our appendix do? What happens if we don't use it? The worst thing that people seem to notice is that your immune system can become very sensitive to illnesses, specifically allergies and asthma. But most people, when they have their appendix removed, even though it's an organ, they're just like fine forever. There is a longer recovery time though. So even though I was planning on just having this endometriosis surgery, and by now I would probably have my much more of my stamina back, but right now I do not. And that is because what happened was I had two surgeries in 24 hours, and one of them was to remove an entire organ. And that incision is much larger, and the recovery time for that specific surgery is much longer. And having two surgeries in 24 hours is much more intense. So plans changed. Oh, and also another thing that I'd like to and that's another answer to the question, like the recovery for endometriosis surgery sounds awful, like you're still not back on your feet. Okay, like first of all, again, with the gratitude, remembering that if you have the ability to do this, be grateful. A lot of people, like, I mean, first of all, for hundreds of years, people have had this as well. And no one had treatment, no one had a word for it, no one had a diagnosis, no one had medication for it. And yes, it's silly that like we still have to cut into ourselves to figure out that this is a thing when we do have things available to us like ultrasounds, sonograms. However, like again, I I made a podcast about this. In other countries, if you have your appendix rupture, you will probably just die. Like, or you will ask a friend of a friend who kind of knows something about medicine to help you. In a country like America, the fact that we have access to insurance, even though we like to complain about it, it's quite wonderful. It is something to be grateful for. You don't have to like it. You don't have to, you can think about how you might prefer it to be, but The alternatives are quite awful. And at the end of the day, I will pick my problems again. So, yeah, the recovery, if you're thinking about this, it might sound poor, but there are people who, if they get a surgery for even just an appendix, may never truly be able to pick something up again. And I know that I will. And really I'm imagining that most people that are watching this are actually interested more in the endometriosis aspect of that. And if you're interested in that part of the surgery and the recovery for that, I want to remind you that there was so much coupled with my experience of the two things in 24 hours and getting an organ removed that have expanded and exacerbated my recovery time. So it's much different. Okay, and the last thing that I want to define before I move on is the word laparoscopy, which is just a minimally invasive or what's called keyhole surgery. And it's just a technique that uses small incisions to diagnose and treat conditions specifically in the abdomen or pelvis. So it's actually like a machine that comes down and it uses, I guess, AI to like mark into you and cut into you. And then the doctor uses that incision to install like a camera. They use your belly button to put in a camera. And then the other incisions they use to use the tools and they navigate around and do what they need to do. But having a laparoscopy is much less risky because there's less of you open. And it's if you can ever do something where the less of you that's open, the better. Okay. Next section, preparing for the surgery, the pre-op. So there's a lot of things in terms of medication and supplements that you need to be aware of. So if you take anything like herbal supplements or fish oil or vitamins, you gotta like stop for about a month before to be really safe, and definitely a week before to save your life. So I stopped everything in my med calendar that wasn't my psych meds for a month before. And then I realized I was having a pretty poor reaction to not taking vitamin D. And I looked up to see if that was safe to take, and it was still. So I incorporated that again. But basically just err on the side of caution and stop taking anything herbal. The main reasoning for this, I know that most of us want to know why. So the reasoning for this is because a lot of herbal supplements are not FDA approved, and many of them will thin your blood. So the main reason is that we don't want you to have thin ass blood when you're getting a surgery, and we don't want you to bleed out. Like that's the main thing. We don't want you to be on the operating table, something to happen, and them to not be able to have you clot or them to need to give you a blood transfusion for no reason. Okay. Um, and also a week before you need to stop taking NSAIDs, which is stuff like Advil, Aleve, um, Motrin, like all those painkillers over the counter. Now, I made the mistake of thinking that also included Tylenol. It does not. So if you are in pain, which you might likely be for a surgery, then you can still take Tylenol. It's okay. Uh, I'm so glad that my friend told me that, because there was like 72 hours the week before where I was quite miserable on the couch. But Tylenol is okay. It just operates on a different system than the rest of the NSAIDs. There are other things that you should not take, though, and please be aware of that. And there are so many things that you would not believe that contain aspirin. So things like cold medicine, Pepto-Bismol, just like look it up. Look up all of the things that you cannot take. And if you are unsure, look it up. You're going to need to be very cognizant of what you are putting into your body the the week before surgery. You're going to be like really raw dogging it. You are also going to get a lot of paperwork from the hospital, from your doctor, and you need to do it all. You have to pay your copay. You have to pay your deductible if that's relevant. You have to fill out so many forms. They're going to ask you your birthday like 4,000 times. Depending on what you're getting, you'll have to do a pre-op appointment, which basically there's an order that the person that's doing the surgery will send, and you go to your regular primary care doctor, or you can probably just go to if you don't have a primary care, you could probably just go to like an urgent care or ask their advice about what to do if you don't have a primary care. And you'll have to pay your copay there as well. And it's just like an exam to make sure that you are safe to get surgery. You'll also have to get blood work done before you go. And that's about 7 to 10 days before you get your procedure done, your surgery done. And that's to make sure that you're healthy, that you can handle the surgery. And you can go to somewhere like LabCorp for that. And again, they'll like give you an order. Okay, now in terms of like preparing yourself and your life, I would say schedule everything so that you have 1000% off for at least 5 days, at least. And that's what I wrote down. And honestly, I'd say if you can do 10, do 10. I don't, if you're just doing the endometriosis surgery, but also you might be watching this and like, you're doing a different kind of surgery. It depends on your recovery time. It depends on you. It depends on your body. It depends on maybe potential complications. I don't know. But I think you need to have a space for you to not expect anything of yourself. I thought I was going to be like, just like body dead and brain fine and just like working from my computer and like really alive. And the first few days, I was not. I was still very, very, very tired. And because your body is really healing, there's a lot of sleep that happens. So just really be prepared to be a potato. As much as I wanted to be up and working and doing all the things and being happy that I was alive, I couldn't really. And do things in preparation for all of this. So like run your errands before, do your chores, do your laundry. If you have a job that requires you to record anything with your face on it or do voiceover work or something, do that before. You really want to batch your stuff so you'll be fine for like a week. And also even think about how to be lazy. Like download movies or have a playlist of stuff that you can just click and watch. I swear, like sometimes I was going nuts just thinking about like what to watch because there's so much crap on streaming. And I was like, this is all bullshit. And I wish I would have just like made like myself a little like this is what I should watch thing. I know that's stupid, but think of things you can easily do on your phone and devices, things that are easy for you to I don't know, games or something or work that you want to do, things that you don't need to move for. I also I got myself oh, hold on, this is before surgery. Well, I guess you could say I ordered myself a onesie that had because I knew that I was gonna have like irritation in my waist area and like maybe wearing pants when I don't really wear pants, but you know, leggings or shorts or even underwear might be irritating in that place. So I got myself a onesie that had like the zipper in the back, like a child, so that I could just wear that and have like an open butt panel to go to the bathroom. And that came in handy in the very beginning. I do wish they would make them not in such warm fabrics though. Okay. Reschedule meetings, really just push everything back. Get food that's easy to heat up. You are not going to want to stand. Set alarms for your meds. Yeah. Okay. And then also you're going to get all of these things that tell you don't wear makeup, don't wear nail polish, don't wear perfume or hairspray or deodorant or lotions. And you're going to be like, why not? And here's why. So makeup and nail polish is if you have anything on your face or your nails, those are the quickest ways for people who are in the room whose job it is to make sure that you are okay while you are under anesthesia and being cut open to make sure that you are okay. To see your blood flow. Like if you have you ever seen like a dead person's nails, how it's like blue or like your face loses color? Okay, so if you have foundation on, they're not going to be able to see that. If you have blue on your nails, they're not going to see that they're going blue. So you need to remove that. It's for your safety. Also, they do something on your finger that reads your oxygen levels. And depending on what kind of crap you have on your nails, that can mess up the reading. But don't just remove the one nail. Take it all off. Take it off your toes. It's to save you. The perfume and the hairspray, that's about the chemicals. So nothing with alcohol in it because the chemicals and the oxygen in the room can create like explosions and chemical reactions. Again, everyone's safety. And the deodorants and the lotions, I don't know that I buy this one as much, but just do it. It says it can make your skin thicker to cut through if they needed to make an emergency incision. I don't know how much I buy that one, but still just they are telling you to not do it. Just please don't do it. I remember one time taking my friend to get her surgery that was elective, by the way, and she had not read any of her stuff. She was like getting prepared in the car. She was doing it so cavalierly, and I just thought how it made me very angry. And I just want to say that if you are doing a surgery, whether it is um, elective, emergency, medical, whatever, you are putting your faith into a lot of other people's hands who have taken a lot of classes, who have spent a lot of their own money, who are also very nervous. And to not even be able to read the directions that say, like, take your nail polish off, um, I think is deeply disrespectful. Take your nail polish off. Okay. Yes. So, oh, another thing in terms of preparing for this is maybe to do the things that I did in terms of thought exercises, like think about how you would want to spend your last days. We're not expecting bad results, but I think it was a really powerful thought exercise for me. Listen to my Just In Case podcast and think about what you would want to do on your last day. Write about it, do it, make a new manifesto, make goals, have things that you're looking forward to, write thank you notes, really use this time to see things through a different lens. Okay, now we're at the hospital. Yes, you can Uber to the hospital. You do not need anyone to sign you in or drop you off. You just need like your ID and an insurance card. And honestly, I don't even think they checked my insurance card because it was already on file because I had filled out so many forms online. So you need to get to the hospital 2 hours before your appointment. So if your surgery is at 12, you need to get there at 10. That's not a joke either. Don't disrespect the time. You will lose your time, and you should. If you can't follow the rules for something so serious, you should lose your time. So you just walk in. Now, maybe your mileage will vary depending on your hospital and situation, but here's what happened with me. I walked in. I was told to check in at the front desk, the main entrance, front desk. I said, hello, here is my ID. I am here for a procedure. I was told to go to room 208, and they said, okay, give me your ID. They scanned it. They made me a little like pass they took my picture, and I had like a little visitor pass. And I signed in on a paper and they told me how to navigate through the elevators that would get me to room 208. I went to room 208 and I was told to go to room 208 before. That came in my email. And I got there. It is a waiting room for people who are going to surgery. A lot of the people in there are waiting for people who are in surgery. A lot of those people are not ahead of you. Someone will come. Well, you go to the front desk, you sign in, they ask again for your ID. Oh, I think they did ask for my insurance cards. They said, someone will be with you shortly. Very shortly, someone came in, they asked for my name. They took me across the hall to a little pre-op room. It was just like a little bed with a curtain. They told me to get dressed in a gown with nothing else on, just no underwear, nothing else. And the gown also comes with accessories, compression socks, which are very weird to put on. It's not just that they're tight, it's that there's like little holes at the top for your toes. Very strange. And then on top of the compression socks, you get like regular socks that have the grippy parts underneath so that you don't slip. So now I'm basically wearing knee highs and yellow grippy socks. Very happy they were yellow, and a gown. And there's also a like shower cap looking thing, but I don't have to put that on yet. They bring in my nurses who were all named Mary, and they set me up with IV ports. So IV ports are basically just something. You can still see the one that they did in my hand right here. And there's another one up here that you can see the bruise from. And there was another one over here. These are places where they're going to insert fluids, anesthesia, any medicine at all times while you're there. So there was only one that I needed for the first surgery. I don't know why they insisted on putting it in my hand. Honestly, those nurses were not the best, even though they were named Mary. The first place they tried to put my IV was here. And I was like, okay. But they ended up putting it here. And it's basically like just a section that is tapping into a vein, and it can be disconnected like a tube, and you can unroll it or uncap it, and you can insert a new medicine, a new tube, and the tube could be saline, or it could be I don't know what the fuck they're putting in me. Whatever they're doing. But it's the quickest way to get something inside of you, intravenous medicine. So they give you the IV ports. They take some blood. They give you wristbands, the one wristband for your identity. And and they'll give you one that says that you're a fall risk because you have anesthesia. And then if you have any allergies or any other specifications, they'll give you those as well. Every time you meet someone new, anytime you're wheeled into a new room, you will be asked to tell them your name and your birthday at the very least. And likely you will also need to explain why you are there. It's so that you can kind of demonstrate that you, like, I guess, don't have dementia, or are cognizant of why you are getting surgery, that it's like your terms, that you have autonomy in the situation, that you understand. I'm not exactly sure, but at the beginning, I was a little confused as to, like, I thought maybe they didn't know what I was there for. But after a while, I realized what was happening, and you just kind of needed to come up with your own little elevator pitch of why you're there in your terms. It does not need to be medically deeply accurate. It's just like why you think you're there, what's happening today. Um, and okay, and then your surgeon should come in. they'll talk to you. Your anesthesiologist will come in, they'll talk to you. If you have any questions, this is the time to ask. They should do their part of explaining whatever is happening to you, with you. And pretty soon after that, you will be wheeled into the operating room. The operating room looks pretty much like what I expected. Maybe not, though. It was very industrious looking. The lamps above where I was laying were humongous. They were like these giant discs that looked somewhere in between like an alien spaceship and a disco ball. There were two of them. I had to move my body from the gurney over to the bed that they would be operating on me from. That bed was not comfortable, but besides the like less than 3 minutes that I was conscious on it, I have no memory of it. I was not conscious in that room for very long. I kind of think that they put that anesthesia in a little early because I was quite talkative and they wanted to shut me up. They did not like my jokes. Um, but I can't prove that. Uh, I there was no counting down for me, is what I mean. Like when I got my wisdom teeth taken out, I remember them gassing me and being like, count down from 99 or whatever, right? There was no warning. They told me like they were putting in my medicine, and I remember making a joke, and then I remember waking up. I was not aware of my last moment. Um, when you wake up, you will be in a recovery area. It is not a specific private room. It is a large room. There are a lot of people walking past you. You will wait there for a while. You might be extremely cold. Anesthesia can lower your body temperature. And this part of the hospital is apparently a lot colder than others for a reason. Keep asking for blankets. When you wake up, a lot of people are going to try to talk to you. I don't know why they're doing this. They have been doing this for a while. They know what anesthesia is. Maybe they've never woken up from it before, but they should understand that you are not at your best. And there's not really a way for you to fully comprehend or communicate in this state. I could talk. I could, it wasn't like I was like in a K-hole. I could speak. I could nod. I could understand. It was just that my like long-term memory was shot at that moment. There was nothing kind of staying, if I could explain it like that. It was just like it was kind of like, I don't know, like a dream or something. I I remember waking up and looking over and I see my surgeon, my doctor. He's my gynecologist. My gynecologist was the guy who actually did my procedure, which is, I don't know how common that is. He's quite good. And Dr. Prashad looks over and he goes, "Oh, you're up." And he walks over and he just starts telling me everything that happened. And just like as if I am fully there. And when I met with him again as a conscious human being a week later, it kind of all came back to me that he'd already told me all this. But I couldn't have told you what he told me at that point. Like, and then he just like left. He dipped and he like went somewhere else. I guess he went to his job at his outpatient office. I don't know, but he was like just waiting for me to wake up so that he could touch base with me, which honestly was fruitless. Um, he did. I do remember being told that I had a tumor though. I do remember that because that part was like shocking. But I kind of remember being like, did he say tumor? It's kind of like you're high. And I had this nurse sitting with me. There's someone that sits with you to monitor you. And she was like the closest thing to being what I needed in that moment because she was just like not expecting me to remember anything, not expecting anything. She just kept giving me blankets. And she was like, I was like, did he have a tumor? And she was like, yeah. She's like, we'll bring over the appendix guy. And I was like, appendix guy? Like, I was not, again, I don't know why they're telling you shit when you're like that. Um, but the recovery room is weird. There, I think it's like an intermediate space between the, at least where I was, where the operating room is and where I was for the pre-op. So there, I saw so many people pass me. It was unnerving. I was like, why am I out like a fish in an aquarium? I don't like this. And that part was so uncomfortable. I was freezing. I didn't like that. I didn't like that part at all. And I didn't know where anyone was. I didn't have my phone. I didn't have anything of my own. I felt exposed. That part was the worst part. Um, I just kept asking for blankets. And then they offered me a beverage and she listed all the things out. I think I made her list them like 6 times because I couldn't like keep anything in my head. And I was just like, okay, water and soda. And I think that was a good call because I hadn't eaten anything. Remember, you can't, okay, I forgot to say that. You can't eat anything for after midnight before the surgery. So it's now, I guess it's like 12:30, noon 30. And it's not that bad, but I've been through a little bit and you can't even have water, like I'm thirsty. So I wanted something to drink and I wanted like a little bit of sugar. So I think asking for both was a good call. And I think that you should do that as a strategy to ask for water and something with sugar in it. Um, because depending on your situation, you might not be allowed to eat again, especially if you're going to have another surgery, get some sugar in you. Okay, what else did I write? The people are going to try to talk to you when you wake up and try to tell you a lot of stuff, how the surgery went, and things that you feel like you should know and remember, but it's okay. A lot of this, all this stuff is written down. It's in a chart somewhere, and it might take you hours or even days to access it, but your brain is on a lot of drugs and it's not going to retain those things, and just let it go. Do not stress, let yourself rest, just lay there. And they should know better than to tell you complicated shit right now. Now, something that I didn't do was to prepare to stay overnight, even though I was supposed to be outpatient. I wish I had not done that. I should have brought my meds. I should have brought my phone charger. I should have brought my stuffed animal duck. Also, I should have brought an extra pillow. Um, there's only one pillow in there, and it's hard to find an extra pillow. There's like one pillow per room. There's an infinite amount of blankets in this place, but one pillow a place. So I get taken into like this other room in the recovery larger area. It's like it's like a private place. It just has a curtain. And I meet the appendectomy doctor and everybody's like raving about him that he's like the appendix guy. And he looks exactly like the guy from the original 1980s Adventures in Babysitting doctor that does the stitches on the kid from high school in the subway knife situation, except he doesn't have a beard. And he feels Slavic. He feels like he's seen some shit, and he has no filter whatsoever. And obviously, I appreciate that, but sometimes in a medical setting, it's not the best. But either way, I can never fault someone for no filter. So he just goes, "You have it," and I'm a little better now. I'm a little better at um taking in information, understanding things. Oh, and my dad has been brought in too at this point. My dad is in the waiting room to pick me up, but he can't take me home now because there is a problem and I need to stay now overnight. And I'm also telling everyone, I don't want to stay overnight. Can I please schedule this and come back? Can I please come back? I don't want to stay here. It's 12. I'm not going to be able to get this done until tomorrow. I don't want to stay here for 24 hours. I have stuff I'd rather just go watch TV at home. And no one seems to be interested in hearing that. They bring someone over to me first. I forgot about this part. They bring someone over to me who looks like she runs a like physical therapy center. And she's like, hello, my name is like Jessica or something. And she was like, I just want to let you know that I hear you. And the reason that that's not probably going to work is that you could do that, but then you're going to have to get a um a new, like, what is it called? Not appeal, but your insurance is going to have to approve the surgery, and you're going to have to go through this and you're going to have to come back in weeks. But if you stay, we can bill out as an emergency surgery, which it is. And I was like, oh. She's like, if you leave the hospital, we start over. And it's going to be more expensive. It's going to be like all these things. And I was like, okay, understood. Red tape nonsense. So, okay, so then now they told me that in the big recovery room. Now I'm in the little recovery room. They bring my dad in. My dad understands that I can't leave. Now they bring in the um, appendix doctor, who I swear they told me his name was Dr. Badger. Again, I'm on medicine. It's not his name. But that's just what I keep calling him because I think it's funny. And he has no filter. And he just goes, you have a tumor on your appendix. It is maybe cancer. We don't know. We won't know. We take it out. We take the whole thing out. We take the tumor out. We take the appendix out. And I was like, can we do that today? I don't want to be here. He goes, today don't work. Busy today. Not good for you to do it today. Tomorrow, maybe. I was like, fuck, man. All right, cool. And and then he left. And then somebody came back and oh no, he came back. He came back in like 30 minutes and said, I found it. We do tomorrow at noon. And I was like, okay, I guess I'm here now. And I am starving now. I don't know why. I am starving. And I am trying to get the attention of people. And I'm like, can I please eat something? And they're like, actually, you are on a clear liquid diet and you cannot have anything. And I was like, I can't have food, like at all? Like, is there any clear liquid food that you are allowing? And they were like, you could have a broth or a jello. And I was like, that sounds great. Let's do that. And they were like, but you can't have it down here. And I was like, where can I have it? And they were like, up in your room. And I was like, I have a room? And they were like, yeah. And I was like, can I go to that? And they were like, not yet. And I just had to keep waiting for them to let me go up to a room. So once that was ready, they took me up to the room and I was checked into the hospital. And I asked immediately if I could order food. And they said I could, but it wouldn't come for a while because they only do like 3 meals when they're actively making stuff. And it was in between lunch and dinner. So I could put in my order, but it would still be a while. So I was just like, I was dying. So ordering food from the hospital is interesting. It's like a real menu, like a diner menu. But again, because the reason that I was on a clear liquid diet is because I was there for a surgery the next day, immediately following one. So when you are going in for a regular surgery, you can eat pretty much whatever you want, um, up until midnight. And that's fine. You just need to have like a clear, empty stomach for about 8 hours so that it's like digested. Now, because of the high risk of getting two surgeries so close together and that they're both in my abdomen, they were like, no, bitch, you are on clear liquids only. So I had to stay on that to decrease the risk of any complications. And the menu that they bring you is just like a diner, and they have like a lot of options. I actually wouldn't have minded eating from there on a different circumstance. But they have sections and options for special diets. So some people are navigating clear liquid diets, and some are liquid diets, but they're not clear. Some are low fiber, some are low carb, and there's other options. So you can navigate the menu in that way. And I was allowed to have broth, Jello, Italian ice, and a lot of different kinds of drinks. And that was basically it. So I was like, I'm ordering all of the broth, all of them. Just bring me the broths. So yeah, that's what happened. And I did that, and they finally got there and I ate, and also having pain meds helped. And speaking of which, advocate for your pain meds. Like, I know that nursing staff and a lot of places that are staffed with people that we really need are very low staffed right now. And I also very infrequently saw any nurse that I had for the entirety of my stay. Every time that I asked for something, it took at least 90 minutes for them to even come back. And they usually had forgotten what I had asked for. Um, and I I had to advocate for anything that I wanted, whether it was the fact that my TV was broken, or that I had asked for, that they had told me that I had a fever and they told me that they were going to give me Tylenol and they never did, or that it was time for my pain meds. So I'm just going to tell you that it's not it's not that they're being mean to you, or I mean, I guess anything's possible, right? But it's not that they're being mean to you. It's not that they're forgetting about you. It's that they are very busy, and you need to get them to pay attention to you, because the loudest voice will win in this scenario. So you need to set a reminder for yourself, and anyone that's with you needs to help you advocate for yourself. So set a reminder, ask them with your pain meds, how long is the turnaround for this? Like, if I'm taking this medicine, when's the next time that I'll be taking this? They say every 3 hours. You set an alarm for 2 hours and 45 minutes. And you have a little remote on your bed, and there's a call button. You hit that button and you say, I'm due. And it doesn't matter if they think you're med seeking. It doesn't matter. They started to think that at the end of my stay. I don't care. I don't care what they think. I they wouldn't give me Tylenol for something that they told me that they were going to do. I know that they were very overwhelmed. I know that they were. And I felt like shit. So, yeah. I mean, it was it's a delicate dance, right? So you have to advocate for yourself. You have to remind people to help you. And yeah. Um okay. And that includes your food too. That includes your food, that includes your blankets, that includes the fact that my TV didn't work, that includes anything that you need. The techs and the aides were a lot easier to discuss things with, because they had, like, not less responsibilities necessarily, but a different kind of them, and they were easier to ask things for. So that's also a tip. Like, if you have the nurse that's responsible for like your plan of care, and I never saw a doctor besides my surgeon. I guess that's normal in my situation. But they're the ones that are giving medicine and other things, and then like a CNA or like a nurse tech, they're someone that's going to come take your vitals and things like that. And there was also a lack of continuity of care and communication among a lot of the staff. So a nurse tech would come in to take my vitals 2 minutes after someone had just done that. You don't have to just say, okay, here's my arm. You can say, oh, did you know that I just had this done? You can say that. And every time they were like, seriously? They don't want to do it either. They don't want to do it either. And they don't need that information 2 minutes after it was just done. They need to start fucking communicating, is what needs to happen. Because most people will just put their arm out and be like, okay, I guess we have to do this twice every 5 minutes. No, it needs to be done like every couple hours to make sure that you're all right. It's not like they need to start talking to each other. There needs to be a better system, and that's not your fault. And it's sometimes it's not their fault either, but you don't have to just roll over with anything that's happening, even when you're sick, especially when you're sick and you don't feel well. So yeah, um, advocate. Write things down, especially when you can't remember them. Ask for paper if they have it. Um, watch TV. And if someone can stay with you, that's great. My dad stayed with me. It was wonderful. Made the time go by faster. Write yourself, journal. Okay. Um, okay, so the sutures. Oh, okay, let me keep going through the process. So oh, so the meds too. Okay. So I take psych meds. Now I had them brought to the hospital, but I take them in a pill calendar. Like I ration them out, I portion them out for the week so that I don't have to take them out of the bottle every single day. I do that once a week. So I just had someone bring the calendar to the hospital, and the nurse came in at one point and they said, okay, so you're on this, this, and this that you take in the morning and this at night and da 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 da. And I said, yep. And I've got it, no worries. And they were like, oh, you have it with you. And I said, yeah. And they were like, can we see it? And I showed them the med calendar and they were like, oh, this won't do. It needs to be in the pill bottle so that we can verify it. Now, obviously, that's some red tape nonsense because I could doctor a pill bottle, or I don't know. It's the same fucking med. They have the meds there too, right? I didn't consider that they could just give me the meds. But one of my meds is a very specific dosage, and they didn't have that because they're not a psych pharmacy. Um, so there was like I got asked 8 times about this med. It was so frustrating. And basically, I want to just tell you that just tell them that if there's something weird with that, where you take something and they're unable to give you the correct dosage, still have your meds with you. Keep them off to the side. Don't tell them that you have them. Tell them that you are fine with not taking it while you're there. End the conversation and just take it when it's time to take your meds, when they're not in the room. It's that simple. They can't condone it. They can't stop you. It doesn't matter. It's your med. You know what it is. I just, it was so frustrating, like how much they were making it a scene. And I was just like, oh my God, I'm just going to take the extra pill right here. And I'm also only here for one day. Like everyone needed to calm down. They were making like I saw so many people on the phone acting like it was the end of their job. I was like, I would love for you to place this level of energy on like getting me my actual pain meds or fixing my TV. Um, okay. So then I go to sleep, and then an hour and a half after I wake up, I get woken up to go take my CAT scan in the middle of the night. Now I stayed up until 12 so that I could keep eating because I knew that I wasn't allowed to eat after midnight. So I kept eating broth until midnight. And then I went to sleep. And again, I got woken up at 1:30 abruptly, and got taken down to get a CAT scan, which took 10 minutes. I don't know why we couldn't fit that in earlier. And I couldn't get back to sleep. It sucked. I had a horrible sleep night. And it's not great to sleep in those hospital beds anyway. So then um in the morning, I was wheeled down to the same state station for the pre-op, and they did the same kind of thing. I met the Dr. Badger guy. He told me about what he was going to do, take the appendix out. Um, I went into the operating room again. I don't remember again. And I'm pretty sure when I woke up, I was actually just in my room the next time. I don't know why I'm having trouble remembering that. No, I wasn't. I was in the recovery room and they had to wheel me upstairs. Um, yeah, and it was pretty simple. It was less time, that operation, and I stayed there and I had much more pain from that. The pain meds that they gave me, I experienced much more relief from anything that was given to me through the IV than anything that was taken orally, which makes sense because, like, again, it hits you so fast. It's a very weird sensation to take something like, what was I taking? Dilaudid, Dilaudid, Dilaudid. It's an opioid and it makes you feel like fuzzy and kind of drunk in your head, but then it just relieves everything. And yeah, that'd be nice to have on tap. I get why people get addicted to it. And I needed that much more the next day. And then I was able to order regular food, but I still had to stay on a restricted low fiber diet. My dad came and around 7 p.m., I requested that I be discharged. And I just wanted to go home. So my discharge nurse came in and she asked me what happened. And I told her, and she was in shock that I'd had two surgeries in 24 hours and that I was fine enough to go home. Um, Most people probably would have advocated that I stay another night. I just didn't want to be there anymore. So all of my incisions, they'll also call them sites, just as another tip. Like a lot of medical staff don't remember that the terms that they use aren't jargon that other people don't understand. So when someone asks to see your site, they just mean the places that you've been cut open. So those were covered. They were all covered in like gauze and these like clear saran wrap stickers. I asked for more of those. I asked how many meds I was going home with. I realized that was not enough. I asked for more. I figured out how we were going to stop at my pharmacy before it closed. I think you should have a plan for that when you're leaving. Ask for more of any of the supplies that you need, like the gauze or the sticky tape or whatever it is that you're using to suture keep your stuff together. Because remember, the reason for the meds is that they were giving me something for one surgery, not two. Advocate for yourself. And I pretty much just had to sign something and they let me go. Um, okay. I think that's everything in terms of the hospital. Being at home, having waistbands, I was right, is uncomfortable. I do recommend getting a onesie. You have to wait 72 hours to shower. You don't want to get any of the sutures wet, the little cuts. They will tell you to put saran wrap or cellophane over the wounds, even on top of the like bandages. And you can do that, but also know that it's just gonna like fill with water and you should be prepared to change the dressing after the first time that you shower, which is going to feel amazing. Wash your hands before you do anything changing the dressing. If you are given painkillers, which you will likely be given, even if they're mixed with Tylenol, any opioids can make you dizzy. You might feel like you want to take something like Dramamine to counter that. Do not, it will intensify it. When I got home, I got this big tote bag and I put all my medicine in it with a non-perishable snack. And for me, that was Cheez-Its. And I put in socks and slippers and just like things that I knew that I was needing so that when I went from room to room or floor to floor, it was easy for me to travel. And the Cheez-Its were because if I needed to take medicine on an empty stomach, there was something there for me to eat. Mm. Okay. When you first get your surgery, they give you this sticker. It's a clear, or not clear, it's a circle holographic silver sticker that goes on the back of your ear right here, like right here. Set an alarm on your phone for 3 days. That is when you need to take it off. You'll forget about it. It is an anti-nausea sticker. It helps with the anesthesia. It helps with the opioid medicine. That's all they tell you when they put it on you in pre-op. They do not tell you about the withdrawal effects. When I took it off, I immediately felt nauseous, so bad. I felt seasick. I felt more nauseous than I've ever felt in my fucking life. It was awful, and it lasted for a while. I don't think you have to wear it all 3 days. I think the longer you wear it, the more intense the withdrawal effects are. They tell you you can wear it up to 3 days. So definitely remember to take it off and definitely be prepared for those withdrawal effects. And again, do not try to counteract it with Dramamine. Anesthesia can give you after effects like tremors. There's a lot of symptoms that happen as a result of anesthesia. So many things, honestly. Brain fog, like, I don't know. Honestly, it was weird. It was really weird. Um, it's not a natural thing. I was shaky a couple days. I couldn't remember stuff. I felt really dumb. Um, I don't want you to ignore any symptoms as a result of being like, oh, I can just put this all on anesthesia. It's not the Mercury retrograde of problems. Like, if there's something wrong, address it. But look up all the symptoms of side effects of anesthesia rather, and be aware that that could be the reason that something's happening. In terms of the endo surgery, bleeding is normal, spotting is normal. I got my period very soon after I got home, and I wasn't sure that it was my period. Um, it turns out that it was because it stopped. I wasn't bleeding as soon as I got home. There was actually very little blood. Um, oh, okay. Actually, when I got out of surgery, when I got out of surgery and I peed the first time, the toilet was full of blood and it was full of like, I don't know that it was pus, but it was bright ass yellow. Bright ass yellow. And that happened like 4 times for the next 3 times that I peed. 1, 2, 3, 4. And it got less and less every time, but I thought that was just going to keep happening. The yellow was bothering me more. I was like, what is that? I think it's just like flushing out, like whatever the fuck is happening. Um, you get pumped full of air with both surgeries, but with any surgery, you get pumped full of air so they can like see in you better. I didn't really, everyone says that that's really uncomfortable. And like a lot of people feel it in their shoulders and stuff. I didn't really have any experience with that, like negative stuff. I don't know. But to be aware of that, the pain that comes with that can be really annoying. Um, With the endo surgery, you can't use a tampon or have sex for at least 4 weeks, probably longer. Nothing in ya, in your vagina anyway. Speaking of the other hole, constipation is an issue for endo surgery and for um, appendix surgery, the appendectomy. Both of these surgeries are likely to cause constipation. I had much less control. I still do have much less control over my stomach muscles. It was hard to pee. I kept doing that, I kept doing like Kegels in the middle of peeing to continue it, like Ben Stiller's dad in Zoolander. It was like, give me a little pee pee. Like, let's just like keep going in the middle of it. Also, oxy medicine can cause constipation. So I had like 3 things going on that were blocking me up. They recommend taking stool softeners and things like milk of magnesia. And that was part of my pre-op plan. So I bought those things and I was taking them daily after I got home as part of my medicine regimen, but I still didn't notice. And I did not poop for 10 days. I somehow just didn't notice it had been that long because of all the other things going on, all the other pains, all the other things. I used to not believe that was possible. I remember I was on a trip with my friends and one of them didn't go to the bathroom for 6 days while we were there. And I just kind of didn't believe them. I was like, really? Nothing? I thought there was like something at least much more wrong, but it is possible. So on the 10th day, God created the worst constipation, a pain so intense that I almost passed out and blacked out from backed up gas. And keep in mind that I've also been lying down a lot of this time, so there's not a lot of gravity action working in my favor either. Um, but it physically hurt to push, to release, to relax. And I also didn't want to hurt anything internally or the sutures. So I ordered a laxative suppository overnight, like a cute girl, and I took it. Do not let that happen to you. That's one of my biggest regrets. A very big mistake that I made. If you are not pooping, take a laxative and go for a suppository. It works in like 15 minutes instead of waiting overnight for subpar results. Plus, I had been taking stool softeners and milk of magnesia already, and it clearly wasn't working. So just saying. And that we'll just say that the suppository worked. Also, sutures are not created equal. It is an actual art by the doctor. One of mine, I have like 5 or 6. Most of them were done by my OBGYN. And one of them was done by Dr. Badger, the appendectomy doctor. And that one is inferior in terms of how it was stitched together. One of them that was done by my OBGYN didn't even need to be covered when I left the hospital. It looked just like a scrape. He's like a genius. In fairness, the length of my appendectomy suture was longer because apparently my appendix was larger than average. Can't hear it enough. And it also had a tumor on it. But that didn't explain how he stitched it back up. When I was healing, all of my sutures started to feel better except one. And I actually started to think that it was infected. And it didn't look like the others. Was like, one of these things is not like the other. And it was warm to the touch and it hurt so much more. And I was like, oh God. So I just went to my GYN and he actually laughed at the stitch work. And but he promised me that it wasn't infected. He was like, no, that's just bad. And I was like, great. A question I got asked was, do you keep the sutures covered? I got a lot of conflicting advice on this. When I left the hospital, one of them wasn't covered by the staff. Like I mentioned, the one that was just like a good scrape. It was barely a wound. It looked like a bad scratch. The discharge information that I got, specifically from the appendectomy doctor, said that I was not to remove the covering or the dressing from the appendectomy scar for 2 weeks and or till I met with him. Based on what he told me, I should still have the original dressing on his scar. Also seems non-hygienic. But when I saw my GYN and I was worried about the infection, he and the nurses said, like, maybe I should just like let it air out. And they were also kind of weirded out about how much gauze and like aggressive tape was happening on my body. So I don't know, different ways. I say definitely leave them on for the first 3 days and do not shower. Leave it be, and then investigate. Pull it off slowly yourself, see how things are going and healing, and then make a decision about whether they should be recovered and if you want to give them some air during the day. But like while they were still really raw, I made sure to cover them while I slept at night because I know I can't control how I move in the bed. A question I got, we're almost done, is my original pain gone? I don't know because I'm still in pain in different ways. So, I mean, as soon as I got home, I like got my period. So I had cramps. So it was hard to tell like if that was gone. Um, because it hurt in a crampy way, right? And then I have all of these external physical things that are healing. Um, cuts, wounds that are in the same location of where my pain was. And the worst one that's healing, the appendectomy one, is on the left side, which is like we saw where endo stuff hurts the most. Um, and honestly, the stuff that hurts the most is all the appendectomy stuff. The like I laughed last night really hard at SNL and shit, I'm gonna do it again. It hurt so bad. I like, had to stop and like and really hold myself. And I can kind of feel the void, like the absence of where my appendix was or something. I don't know. I can feel some sort of pain there. And I mean, there's just a lot that's changed inside of me. There's places where stuff was burned. There's places where stuff was chopped off. There's stuff that's trying to heal inside of me and on the outside of me. And is my original pain gone? I have no idea. I'm still in a lot of pain. It's different, but I can't tell yet. I talked to somebody else who recently had the surgery about a month ago, and I asked her how she feels today. And she said that most days, 70% of her pain is gone. And that's fucking great. I will take that. So I'm looking forward to that. It's just my recovery time is going to be elongated and exacerbated because I had 2 surgeries, and one of them is very different. Another question that I got was, how long did you wait to find out if you had cancer? How did you find out? I still haven't. It is October 14th at 5 p.m. And I called earlier. I've called 4 times now to the doctor, and they keep saying that they are calling over to the hospital and that they don't have the results. And that today she told me she would call back by 5 p.m. It's 5:04 right now, and she has not called. So I don't know. Um, but I know that it doesn't really matter. I know that I'm alive. I know that I don't feel I don't feel like I have cancer. I don't identify as someone who has cancer. I um I know that even if it's positive that it's going to be okay. What would happen if it was positive is that I would get another surgery to cut off more of me near my intestines and my colon to make sure that it did not spread, and anywhere else that it would spread, and they would do more tests. But I'm not going anywhere. And how would I find out? I don't know. This fucking Dr. Badger's office better fucking call me, is how I would find out. It has been enough days. They told me that it would take up to 10 days. And let's see. 1, 2, 3, 4, 5, 6 business days. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 actual days. So I don't know. But I feel like tell a girl. Um, what do you do if something is wrong? You contact the surgeon first. So like you'll have some sort of relationship with the doctor that's doing your surgery. Uh Usually it'll be like the person you've gone to see them in an office beforehand. It's not like you just get assigned somebody. Usually you're seeing them beforehand and they have an outpatient office. They aren't just existing in a hospital. You don't have to go to the ER to see them. So even this Dr. Badger guy, even though he is in the hospital a lot, mostly, he does have outpatient hours at his office. So I have to go see him. Oh, I just got those little like fairy dust things, like when I do a cartwheel. That's so weird. What did I do that deserved that? And these lights have just been on for so long. Um, I have been talking for quite a while. It's a long episode. Okay. So they have outpatient locations and you can call their admin and make an appointment. And you need to do a post-op appointment with them to make sure that everything's going okay. So if you have an issue, if you have a question, you can call them and you can schedule something and you need to regardless. But yeah, you aren't just on your own after you leave the hospital. You can ask them. And speaking of being on your own, you do need someone to take you home. You can't really, I don't think you could just Uber home. I I'm almost certain that that wouldn't work. You need someone to kind of check you out. I don't know. Hold on. I didn't actually Google that because I was pretty sure that it wouldn't work. Hold on, let me. Okay, so it depends on where you're located. So there's something called Uber Health. And in where I live, Baltimore, Maryland, there's something called Uber Health, and it says non-emergency medical transportation is available. So this is for transportation home from a hospital. Okay, that's really cool. So there are services offering transportation home from hospitals, and Ubers and Lyfts can do that. And it's like, I guess that you would need to specifically go onto Uber Health and look for non-emergency medical transportation. So it's like you're being realistic about the fact that you're coming from a hospital and coming home from a hospital, and it's not like they're an ambulance, but like that you might be loopy or something like that. So that's great to know. Actually, I'm glad that I looked that up. Okay. I think that I've answered pretty much everything. Um, the last remaining bit is just to get the autopsy? No, biopsy. um Diagnosis results in and give you guys all that update. And that's it. But this was meant to be something that kind of just eases your mind and answers questions and walks you through what it was like to go to the hospital, be in the hospital, get anesthesia, um, go into an operating room, go into the recovery room, and then also find out that something went wrong, something extra happened, and meeting doctors and getting medicine and advocating for yourself and staying overnight. And um, oh, like my dad came and he was kicked out at like 9:30, and it wasn't like aggressive. They weren't like, get the fuck out. Like they were like, hey, but they also asked, are you staying the night? And I think they would have let him stay the night. But if he was leaving, he needed to leave at 9:30. And he said, I'll leave in 5 minutes. And they said that was fine. So, it's just little things like that. I think when we have someone be a guinea pig for us, it can really help ease our mind because uncertainty is what creates fear. And when we have a plan for something, we feel more confident about it. And I have confidence about doing most things, even when I am uncertain. And I think that's a gift that I have, and I want to share it with people through the procedure of documenting new experiences. So I know that this was long and long-winded. I just wanted to go through things as I experienced them. So I hope that this was helpful. If you have any more questions, please feel free to contact me or leave a comment and I will answer them. Actually, I think probably leaving a comment would be the best way on YouTube or the Spotify um, comment section so that if you have the same question that someone else has, they can get the same answer. And if you are suffering from endometriosis or you think that you are, I feel for you, dude. It sucks. And bring it up with your OBGYN and don't wait. This isn't me like sponsoring surgery or something. I never got a surgery before this. And then I got 2 for 1. Well, not the cost of one. I don't even know what that's gonna be like to get that bill because I didn't pay for that one in advance. I don't know. So yeah. But now they've burned off everything and now I'm going to start oh, that was another thing. So I'm going to start taking medicine so it's birth control and another medicine that's specific for endometriosis that will prevent endometriosis from continuing to grow. Because even though they burned all of those little black things out of me, it will just come back. It's just like a little plague that will just keep coming back all over the place. So I have to be on these the rest of my life. So I just start taking that soon and it'll prevent more. And that's cool, right? That we have the ability to have that kind of medicine. It's pretty neat. And hopefully that will prevent the pain. That will change a lot. Yeah, and the fact that I also had my cyst taken off, so that will hopefully help with the irregularity of the periods and also other symptoms, and side effects of PCOS. So, yeah, but again, you can't get diagnosed with endometriosis until you they see it inside of you. So, yeah, I'm looking forward to having less pain. That's the main game of this whole thing, of life, really. Increase pleasure, decrease pain. Okay. Thank you for listening. Again, if you have any questions of things that I did not address, I'm sure there'll be something large that I was just like completely oversighted on, but I try to be thorough. I love you. Thanks for listening. I'm so glad that I'm still here. And remember, you have to feel good to do good. I love you. Oh, and check out the Positive Pulse. It's a new free, happy resource library and community at your disposable, at your disposal for free. Uncustomary.org/positive-pulse. I'll put the link below. I love you. Bye-bye.